everyone, Namaskara. Myself Dr. Nishchita, Ayurvedic practitioner and clinic head at Madhavbagh, Jainagar. We all must have come across someone who had an heart attack, someone who had an heart attack and lost his life right away, someone who was taken to emergency care and recovered later, someone who had a heart attack but didn't even know about it but got to know through a physician on a general checkup. Whatever the scenario, none of us would want to experience a cardiac emergency, right? Do you want to know how your heart is functioning? What is the condition of your heart? Here I am to explain to you. Wait a minute, we will go ahead, shoot your queries. Who is prone to getting a heart attack? Well, anyone with a heart is easily prone to get a heart attack. However, certain underlying conditions like high blood pressure, diabetes, high cholesterol levels, obesity and thyroid issues can increase the risk of heart attack. How can we save ourselves from heart attack? To prevent heart attack, it is essential to address the underlying risk factors. It is important to maintain HbA1c below 6.5%, maintain blood pressure within 120 by 80 mm of Hg, to control your cholesterol levels, to take care of your BMI between 24 to 26 kg per meter square. What else should be done to prevent heart attacks? Well, the important factor here to prevent heart attack is regular monitoring of your heart health. The three main important investigations to know the cardiac function includes ECG, 2D echo and treadmill test. What is a 2D echo test? 2D echo test is a non-invasive scan done to evaluate the structure, component, size and position of the heart. Also, it helps us to understand the pumping capacity of the cardiac muscles. What is an ECG? ECG or electrocardiogram helps us to assess any abnormality in the electrical impulses of the heart at rest. Also, it helps us to evaluate the functioning of the heart at rest. What is treadmill test? Treadmill test or stress test is a test done to know how your heart functions when it is under stress or physical exertion as in exercise. Understanding its physical tolerance capacity helps us to understand if it can face any untoward incidents like heart attack. Is there any alternative to treadmill test or stress test? In cases where treadmill test is not possible, we do a test called a 6-minute walk test. Here, a patient is asked to walk for 6 minutes, post which ECG is taken. Any changes in the ECG helps us to understand any deformities in the heart function. To sum up, patients with underlying risk factors like diabetes, high blood pressure, high cholesterol levels, thyroid, obesity are best to go through these investigations like ECG, 2D echo and treadmill test on a regular basis. Also, people beyond 35 years, it is essential to evaluate your cardiac health on a regular basis to know how good your cardiac health is and prevent heart attack in the future. Before we end this video, let us learn an interesting fact about heart attacks. Heart attacks can happen at any time of the day, but however, studies have proved that heart attacks mostly happen in the early morning hours. Why is this? This is because the morning stress hormones are high as soon as we wake up. Blood pressure surge may happen at this time. There is increased heart rate and blood clot formation is high at this point of time, because of which it becomes a favorable situation for a storm like a heart attack to happen. I hope you all enjoyed today's discussion on how to prevent heart attack by assessing your cardiac health. In the next video, let us talk about the lifestyle changes to be done to prevent heart attack. See you soon. Until then, take care of yourself, take care of your health. Don't forget to subscribe to our YouTube channel and click on the bell icon.